Have you ever wondered if the very tests meant to save your life could actually be the ones that steal your peace of mind, or worse, your physical health? The key to a long and healthy life truly lies in early detection. We must learn to look for those hidden problems within our bodies. But what if I told you that for those of us over the age of 60, some of the most common medical screenings recommended today can lead to a cascade of unnecessary surgeries, dangerous medications, and life-altering stress? It is a shocking truth that many seniors are never told in the exam room. As we age, our bodies change in ways that make certain tests less accurate. You might be following your doctor's orders to the letter, thinking you are being proactive, but you could accidentally. If you have been scheduling every test offered to you without question, you might be doing your health a great disservice. The reality is that for a body that has thrived for 6 or 7 decades, sometimes the most protective thing we can do is slow down. The best thing you can do is say no to a screening that offers more risk than reward. If you want to protect your health and avoid common mistakes, subscribe for more videos like this. We have spent our entire lives being conditioned to believe that more information is always better. We assume that if a machine can peek inside our bodies and find a tiny abnormality, we are winning the battle against aging. However, as we cross the threshold of 60, the benefit to harm ratio of medical screenings shifts dramatically. Our bodies are like classic cars. They naturally develop small dents and scratches over time that don't necessarily stop the engine from running perfectly. When we go looking for these tiny imperfections with highly sensitive screenings, we often find things that are technically abnormal, but clinically irrelevant. This is the hidden danger of modern medicine for seniors. A common habit, like getting a routine scan, can trigger a series of events that you cannot easily stop. Once an abnormality is found, it is very difficult for a doctor to tell you to just forget about it. This leads to biopsies, follow-up scans, and often invasive treatments for conditions that would have remained silent and harmless for the rest of your life. The risk isn't just a bit of anxiety, it is the very real possibility of suffering complications from a procedure you never actually needed. According to many specialists, the first screening where the risks often outweigh the benefits for seniors is the routine PSA test for prostate cancer. What most people don't realize is that prostate cancer is often a very slow-growing condition that many men will live with for decades without ever knowing it. Doctors often see this mistake where a slightly elevated PSA level leads to a painful biopsy, which then leads to surgery or radiation. For a man in his 70s or 80s, the side effects of these treatments, such as incontinence or significant physical weakness, can be far more devastating than the cancer itself, which likely would never have caused symptoms. Many specialists now suggest that if your life expectancy is less than 10 to 15 years, or if you are already managing other significant health issues, the catch is simply not worth the cost. Instead of a blanket screening, doctors often suggest a more nuanced conversation about your specific health history. It is a powerful form of emotional reassurance to realize that not every growth is a death sentence. And sometimes, watchful waiting is the most courageous and healthy choice you can make. The second area where specialists often see unnecessary risk is in the routine screening for colon cancer in the very elderly. While colonoscopies are a vital tool in middle age, the procedure itself becomes significantly riskier as we get older. The preparation for the test can cause dangerous dehydration and electrolyte imbalances in a 60 or 70-year-old body, and the risk of a bowel perforation or a bad reaction to anesthesia increases with every decade. According to many specialists, the benefit of finding a polyp in someone who is 80 years old is minimal because it often takes 10 years or more for that polyp to turn into something serious. Doctors often see patients who are pushed into these invasive screenings out of habit rather than a clear medical benefit. What most people miss is that there are now much gentler, non-invasive ways to check for signs of trouble, such as stool-based tests that can be done in the comfort of your own home. By choosing the less invasive path, you protect your body from the physical trauma of a procedure while still staying vigilant about your health. Another surprising truth involves the routine screening for thyroid nodules
using ultrasound. As we age, it is incredibly common for small bumps to form on the thyroid gland. In fact, if you were to perform an ultrasound on every person over 60, you would find these nodules in more than half of them. What most people don't realize is that the vast majority of these nodules are benign and will never cause a single problem. However, once they are seen on a screen, they often lead to a biopsy with a needle, which can cause bleeding or nerve damage. Doctors often see this cascade lead to the total removal of the thyroid gland, which forces the patient to take hormone replacement medication for the rest of their life. Specialists point out that thyroid cancer is often so slow-moving that it is rarely the cause of death in seniors. By avoiding routine, just-in-case ultrasounds of the neck, unless there is a physical lump you can feel, you prevent yourself from entering a medical maze that often has no easy exit. What most people don't realize is that the incredible stamina of elite soldiers, the ones who could march 20 miles a day, even 50 years after their service, wasn't maintained by constant medical testing, but by a deep trust in their body's functional ability. These individuals understood that if the machine is working well, you don't take it apart just to look for rust. Doctors often see a similar mistake in the routine screening for blocked arteries in the neck, known as carotid artery screening, in people who have no symptoms. According to many specialists, finding a partial blockage in the neck of a 70-year-old is almost as common as finding grey hair. But when this is discovered, it often leads to high-risk surgeries to clean out the artery. The surgery itself carries a significant risk of causing the very stroke it is meant to prevent. Specialists often argue that for most seniors, the best screening is simply monitoring your blood pressure and staying active. If you can walk, talk, and think clearly, your arteries are doing their job, and poking around with scans can often stir up trouble that was better left settled. The fifth screening that often causes more harm than good is the routine use of total body scans or excessive imaging for minor back pain. We have been taught that if our back hurts, we need an X-ray or an MRI to find out why. But what most people miss is that an MRI of almost any 60-year-old back will show bulging discs or degenerative changes. These sound like scary medical diagnoses, but they are actually just the normal signs of a life well lived. Doctors often see this mistake where a senior sees a disc issue on an MRI and suddenly begins to feel like they are broken. This fear causes them to stop moving, which leads to muscle wasting and even more pain. The imaging often leads to spinal injections or surgeries that have a very low success rate for chronic pain. Specialists often suggest that the best approach for a senior with a sore back is physical therapy and gentle movement, rather than a deep dive into the internal scenery of the spine. When you realize that your abnormal scan is actually quite normal for your age, you regain the confidence to keep moving and stay strong. Now, I want to provide you with a simple, safe, and realistic way to navigate these medical decisions. The most important action step you can take is to ask your doctor 3 specific questions before agreeing to any screening test. First, ask, what will we do if the results are abnormal? If the answer is, we will do more tests or we will do a high-risk surgery, you need to carefully weigh that against your current quality of life. Second, ask, how will this test change my treatment? If you're already doing everything you can to stay healthy, a new scan might not actually offer any new solutions. Third, ask, what happens if we do nothing? Many times the answer is nothing at all, and that is a perfectly valid medical path. By having this conversation, you move from being a passive recipient of medical habits to being an active partner in your own longevity. It is completely normal to feel a bit of anxiety about turning down a test. We have been told for years that early detection saves lives. But it is important to understand that early detection is a tool, not a rule. In our younger years, it is a very sharp tool. In our later years, it can become a double-edged sword. I want to reassure you that choosing not to have a screening is not the same as ignoring your health. In fact, it is often a sign of deep wisdom and a commitment to protecting your current well-being. Your body has proven its strength over many decades. It knows how to maintain balance, By being selective about which tests you undergo, you are actually protecting that balance. You are choosing to spend your time in the garden or with your grandchildren rather than in a waiting room or a recovery ward. What most people don't realize is that our healthcare system is often built on protocols that are designed for the average person. But you are not average. You are an individual with a unique history and a unique set of goals for your later years. Specialists often see that the most vibrant seniors are those who focus more on how they feel than on what their latest lab report says. If you have energy, if your appetite is good, and if you are able to do the things you love, that is a much better indicator of health than a PSA score or an incidental finding on a scan. You have the power to decide what health looks like for you. It doesn't have to be a constant search for something wrong. It can be a celebration of everything that is going right. I want to give you back the hope that aging does not have to be a series of medical crises. Many of the problems discovered in screenings are simply the body's way of adapting. A small nodule or a slightly narrowed artery is often just a sign that your body has found a way to keep working despite the passage of time. When we interfere with these adaptations based on a screen, we can sometimes break the very system that was keeping us stable. Reclaiming your right to a peaceful body is a beautiful part of growing older. It means trusting your instincts and knowing when to say enough. Small changes in how you approach your doctor's visits can make a massive difference in your stress levels and your physical safety. Think about the wisdom of those who lived before the age of high-tech scans. They listened to their bodies. They noticed when they were tired, when they were in pain, or when something truly felt off. We can return to that wisdom while still using modern medicine when it is truly necessary. This is the middle path of senior health. It is not about being anti-medicine, it is about being pro-health. It is about using the best of what we have without becoming a slave to the machine. You have the wisdom of your years to guide you. Use it to decide which tests are truly a service to your future and which ones are just a distraction from your present. As you move forward, remember that you are allowed to change your mind. You might decide to have a screening this year and skip it the next. That is okay. Your health needs are not static, they change as you change. The key is to stay informed and to never feel pressured into a procedure that doesn't make sense for your life. Doctors often see that patients who are confident and ask questions receive better, more personalized care. You are not a difficult patient for wanting to understand the risks. You are a smart one. Your body is your home, and you have every right to decide who gets to come in and look around. I want you to feel a sense of peace about the choices you make. There is no single right way to manage your health after 60. There is only the way that feels right for you. By understanding the potential for overdiagnosis and the risks of unnecessary screenings, you are arming yourself with the truth. This truth is what keeps you independent. It is what keeps you out of the hospital and in your own home. You have worked hard for your life. Don't let a routine test take it away from you. You are in the driver's seat, and you have a clear map to a healthy, active future. Take a moment to visualize your life 5 years from now. See yourself active, engaged, and free from the burden of unnecessary medical complications. This future is built on the decisions you make today. Every time you choose to ask a question, every time you decide to focus on your function rather than a scan, you are investing in that future. You are choosing a path of resilience. This is the ultimate goal of preventive care, to prevent the system from causing more harm than the passage of time ever could. You are the guardian of your own longevity, and you are doing an incredible job. In summary, as we age, the benefits of certain routine screenings, like the PSA test, colonoscopies for the very elderly, thyroid ultrasounds, carotid artery scans, and excessive back imaging, often pale in comparison to the risks of overdiagnosis and invasive follow-up treatments. These tests can find incidental issues that would never have caused harm, leading to a cascade of medical interventions that can ruin a senior's quality of life. By asking your doctor critical questions about how a test will change your treatment and what happens if you do nothing, you can avoid the medical maze and focus on functional health. Trusting your body's signals and prioritizing how you feel over abnormal scan results is the key to staying strong, independent, and safe in your later years. Take care of your body because it is the only house you have to live in. Small steps today, like having a candid conversation with your doctor about the necessity of your next screening, can make a big difference in your long-term health and happiness. You have the power, the wisdom, and the right to choose the path that is best for you. Stay strong, stay informed, and remember that sometimes the best medicine is the one you decide you don't need.